And welcome back to Life Unrehearsed. Matt Del Vecchio here, specializing in home care, elder care planning, and the senior living industry. Thank you for tuning in. Hope you're enjoying your day today. A little soggy and rainy out there. You know, Life Unrehearsed is aired on the last Sunday of every month. I try to tackle topics that are affecting families as our population ages and our healthcare system that is struggling to keep up. You know, I want to do a quick PSA announcement for an upcoming event. The very first DDO Seniors Fair is happening. Mark your calendar. The DDO Seniors Club, in collaboration with the City of Dollard-des-Ormeaux, is proud to present the first ever DDO Seniors Fair on Friday, April 11th. It's going to be held from 11 a.m. to 5 p.m. at the Community Center, entrance number 5 of the Dollard Civic Center. Everyone is welcome at this free event. You don't have to be a resident of DDO to go. It's going to be very good, actually. Lots of booths there. The fair aims to connect seniors with community organizations and local businesses, offering a variety of services and resources tailored to their needs. You know, enjoy a warm cup of coffee at the fair, and you're going to meet fellow seniors and explore many resources that are available out there in the community. You could find out more by looking up ddoclub55.com. Okay, ddoclub55.com. All the information is there about the DDO Seniors Fair being held on April 11th. I want to thank Albana and her team for organizing the fair. Tons of work going on there, but certainly well worthwhile to do a quick visit. I'm going to be there for that event, and my next guest, Kirstin Bennett, will also be at the DDO Seniors Fair. You know, as we age, more care is required at home. However, it's putting enormous strain on our healthcare system. In fact, the number of people waiting for home care through the CLSC has almost doubled just in the last 4 years. Our population is aging quickly, and quite frankly, the government just can't keep up. Well, to help guide us through these muddy waters, I'd like to bring in Kirstin Bennett. She's the Managing Director of Premier Home Care. She's also a certified professional consultant on aging. Kirstin, welcome back to Life Unrehearsed.
Thank you, Matt. Happy to be here.
Well, thank you for joining me. Tons of information to get out there. So first of all, if we wanted to pursue home care services through the CLSC, which is the only way to get public home care, what is that process like?
Well, I mean, when there's a hospital stay, or particularly after a time at a rehab center, you'll typically be provided with that opportunity for home care support. If nothing is being offered, I'm always saying to advocate for it, okay? So it's the social worker or the discharge planner who will assist with this. But if it's not upon a discharge, then to begin, you have to have an in-home assessment by a social worker, typically, or sometimes a nurse case manager, to be able to have a file opened for receiving the services. And there are a few ways to do this. You know, you can request this. Sometimes it can be the family doctor who can put this request in. Sometimes a family member can call. There's a guichet d'accès that can be reached out, even the individual themselves. So if, though, you aren't getting anywhere, which sometimes happens, you can also, request through 811. So you can call 811. People think that it's typically just for info santé, but actually, if you press 2, it's for info sociale, and if you press 3, it's the guichet d'accès. So that's a good way to go about it as well.
So different ways to go about it. Again, through the CLSC, sometimes we even get calls, oh, Matt, you have a team of social workers. Let them do the assessment. I'd love to, but it has to be a CLSC social worker. Not necessarily the easiest process, but once you're in, you know, you'll get it done. So all this to say, like you're saying, Kirstin, you've got to advocate and persevere and try to get that home evaluation done. Now, once that's done, they're going to determine if you qualify for some home care services. But Kirstin, there's something called Chèque Emploi Service. It's actually a very interesting government program. I like it. It's just hard to get it. But what is Chèque Emploi Service?
Well, it's the support services from the Health and Social Services Network are made available. It's a financial allowance sort of granted through this program. It's an allowance basically that's allocated to you by the CLSC. It has to be done through, though, the person that has assessed your needs and established a plan specifying the number of home care service hours that you are entitled to. So rather than the CLSC sending different caregivers, you can choose the person who will provide the home care support with a subsidized rate.
Very interesting. And that, just let's face it, labor is hard to come by in the healthcare sector. This is one way where you can hire your own caregiver and get some subsidies from the government. Very smart. Hard to get it, but you really need to advocate for that. Listening to Life Unrehearsed, I'm Matt Del Vecchio, and I'm talking about aging at home, or it's sometimes called aging in place. I'm with Kirstin Bennett from Premier Home Care. Kirstin, you're with Premier Home Care. There are many home care agencies out there that are also private. Why are families hiring some private home care when you can get it through the CLSC?
Well, when you can get it, right? So when the public system works, it works super well. And when it doesn't, it unfortunately doesn't. Like I've seen some situations where families are provided excellent support from the CLSC and it just works for them. But I also see the complete opposite when it's very overwhelming and somewhat painful for everybody involved because they're not getting the services that they really require. The CLCs, like you had mentioned before, really are simply overextended and cannot provide all the support that is being requested by them. So, and in addition, I would also say the CLSC, because of this request, are very task-oriented. So it's very short visits. It doesn't always fit into the family's schedule. So private home care is available at home, but also, interestingly enough, it's also available where the CLSC is not. So in hospitals and rehab settings, for example, for overnight care, perhaps. But, ultimately, private home care can provide you with more options, more personalized support for the person and the environment that they live in, more consistency in the care. It's really private home care is designed to create a unique care strategy and provide a better support system at consistent times with consistent caregivers.
Yeah, you bring up an important point about consistent caregivers, particularly when dealing with, I would imagine, clients that have some form of neurological disorder, dementia or Alzheimer's, where the CLSC is kind of like a turnstile of caregivers, right? And so some families want to opt for a consistent caregiver, which makes sense. The government is recognizing that the wait times are very, very long, but there are some government tax credits, I believe, out there for families, even if you are hiring private, isn't there?
Sure, yeah. There's the home support tax credit is the one that's most used for private home care invoices, and the home support tax credit is basically designed to allow people to remain in place. So it could be even your snow removal could be used, but you have to be over the age of 70, and you have to be a resident of Quebec. If you meet both of those conditions, then you can claim the tax credit regardless of the level of your dependent. So it is, however, also takes into account your income. But, the good thing about this is that if you're on the lower income level, and it's a refundable tax credit, which means you can receive it even if you don't have any income tax to pay for the year. So that's pretty cool. There's also, if you are considered a dependent, so basically you're requiring assistance because of your mobility issues or your cognitive issues, then you can apply for an additional eligibility credit. You can find the form and information on Revenue Quebec website. There's actually quite a good information there. And then for caregivers, the Quebec and federal government, they are trying to provide some level of assistance here. There's not a lot, but there, and still needs some work to be done. But there is something you could look up, the Canada Caregiver Tax Credit and the Quebec Tax Credit for Caregivers.
There are certainly some credits out there, hard to navigate,
Sure.
But there are tax credits out there. I think the government finally is realizing, long waiting list for long-term care homes, long waiting list for home care. Let's try to support caregivers in what we're doing. In fact, talking about caregivers, National Caregiver Day this Tuesday. We're going to be talking about this just after traffic. We're already at a time, Kirstin. If some of our listeners want to get a hold of yourself, how do they do that?
Sure, thanks, Matt. I mean, the best way to do it is at premierhomecare.ca. All the details are there. There's a form you can fill out. We can contact you that way as well. But our telephone or info@premierhomecare is the email address. So we're here to help and just provide information, even if people have questions and want to know how to get started.
Wonderful. Great. Thank you, Kirstin, taking a little time here on a Sunday.
Thanks, Matt.
All right, that's certified professional consultant on aging, Kirstin Bennett. Kirstin's the managing director of Premier Home Care, a Montreal-based company offering personalized home care services. All right, next up, did you know that this coming Tuesday is National Caregiver Day? Of course you do. I just said it. I'm going to be talking to caregiver specialist Claire Webster about some ways to help caregivers throughout their caregiving journey. But first, let's head out to the CJD Traffic Center, and we're going to hear from Marty Lamar.